so excited to be here at the Health 2.0 STAT event, and thank you very much for having me. When envisioning this presentation, I really started off wanting to create a really happy picture and talk all about the Health 2.0 initiatives that are going on at the NIH Clinical Center. But unfortunately, as I started researching the topic and interviewing people, I actually realized we have a long way to go. And I just came from the mHealth Summit last week. I'm not sure if anyone else was there, in DC. Yeah, I know Mike was there. And I heard about all the use of mobile technologies in healthcare and bridging the gap between patients and their providers and quality health information. And what I realized is that the clinical center is often really slowed down. Not only slowed down by regulations and compliance, but we're also really risk averse. We're so worried about taking risks that we'll often wait for other organizations or agencies to do it first, so then it's a little less risky for us. But we have a really important mission to take care of, and so I don't think we can afford to be slowed down. So tonight what I want to talk about is a brief analysis of some of the steps we have taken in the right direction, but also some challenges that we faced along the way. So my example today is our initiative called a patient portal. In recent years, we've really recognized the importance of patient-to-patient contact, peer-to-peer interaction, as a support and empowerment for patients at the NIH Clinical Center. And the portal is a way for patients to learn more about their disease, more about NIH, and also the power of peer support. So just to put this in a little bit of context, I want to tell you just something about the NIH Clinical Center. We are the hospital on the NIH campus, and we only admit patients enrolled in a clinical trial or a protocol, so it's a complete research environment. We admit 10,000 new patients a year, and an average patient stays for about 9 days. Something we specialize in is seeing people with rare, unique diseases, oftentimes undiagnosed diseases, and the clinical center might be their last resort. We have a beautiful facility over in Bethesda, just a couple miles north here, and we have a 240-bed new facility that just opened up in 2004. One of the things I want to point out is that we have the potential to deliver cutting-edge patient care. One of the examples is that in 6 of our inpatient units, we have computers at the bedside. Now, I'm a social worker by training, and one of our principles is you should always meet the client where the client is. That's one of my favorite principles, and I think it applies here as well, because these computers are an opportunity to bring healthcare and support and information where the patients are. So let me talk a little bit about this patient portal. It is a website that we offer. It's the default setting on these patient computers by the bedside, and it's designed to provide educational tools and other resources in a central location. It was launched in 2006 as a pilot and has been evaluated periodically since then. Here is a shot of that patient portal. Now, as you can see, it truly is a website. Links, links, and more links. This is one of the things I think is a weakness of this site, is that it's actually just a lot of links everywhere, and it's mostly practical information. Now, that actually we found in some of the evaluations to be a good thing. The patients did like the information on parking, food, linen service, and things like that. But really, there's no interaction embedded into this patient portal itself, nothing that the clinical center itself came up with, other than a feedback box where people can provide comments to an email box. So in the evaluation, we found out that most patients did think it was user-friendly, and they oftentimes found what they were looking for. But one of the things they could not find that they were looking for was that support, that peer-to-peer interaction. So enter care pages. This is something that the patient portal does feature that I actually think finally embraces Health 2.0. So I was excited to learn more about this initiative. Care pages is something we use as an interactive community to connect patients to each other. And it's a really, really exciting thing, and it's one of the most used features on the patient portal. So this is something that a patient can log into the clinical center patient community, create a profile page, and share as much information as they feel comfortable. They can invite people, including their family, even outside of the Care Pages community, to view their profile, and also invite other patients that they interact with. They can send messages among patients, they can blog about their experiences, they can participate in discussion forums, and even show pictures. So for me, like I said, this is true Health 2.0, and I'm so excited that the Clinical Center has started to embrace something like this. But the problem with this patient portal is that funding has completely gone away. And this is one of the biggest problems, is that there's no staff or money to keep this up to date and to really push this forward with the momentum that it needs to be successful. So I will give you a couple of stats here. Since 2006, December, we've had 53,000 visits. So that's a great step in the right direction, but we'd like to see that go up and up and up every single year. So, future directions, where am I going with this? Obviously, I can't understate the importance of technological infrastructure to be able to upgrade the hardware on these computers so that they're not slow, so that patients do want to use them, and so that they actually are useful and an instant resource for patients. But that requires money and a commitment by the NIH and by the Clinical Center, and thus far we have not seen that yet. I think we need to start embracing the idea of government being a little bit more risky. Government could be the ultimate startup, and we should be willing to take risks. That's going to require a big culture change. We have to realize that government has the ability to experiment, fail, try again, succeed, rinse and repeat. Thank you.